Objective. At the end of this presentation, the students will be able to explain Introduction to Management and Organization, distinguish reductive and adaptive theories, describe traditional structures in healthcare organizations, identify essential terminologies used in management. Introduction. Management. Management is the coordination and administration of tasks to achieve a goal. Such administration activities include setting the organization's strategy and coordinating the efforts of staff to accomplish these objectives through the application of available resources. Organization. When individuals come together to fulfill a common aspirations, organizations are formed. Some organizations are small, as to individual with simple structure. Some may be large and complex. Definition of organization. A collection of people working together under a defined structure to achieve predetermined outcomes using financial, human, and material resources is known as organization. The philosophy is a written statement that reflects the organizational values, vision, and mission. Organizational theories. The purpose of theory-derived organization is to design work and optimize human talent in a manner that best accomplish the aspirational goals of the organization. Management principles derived from Adam Smith in 1776, who studied how organizations specialize and divide labor into piecework. Types of management theories. These theories began to address work design, individual and group motivation to improve performance output, which are as follows: reductive theory, humanistic theory, adaptive theory, reductive theory. Reductive theory is also known as classical theory. This theory focuses on the nature of the work to be accomplished, creating structure to achieve the work, dissecting the work into component parts. Elements of reductive theory. Reductive theory has 4 elements, which are as follows: division and specialization of labor, organizational structure, chain of command, span of control, division and specialization of work. Dividing work, reducing the number of tasks that each person carries out, to increase efficiency by assigning repetitive tasks to dedicated workers and improve the organization work. When work is designed in such a manner, managers exert greater control over productivity. Organizational structure. Organizational structures work group arrangements based on the concept of departmentalization as a means to maintain, command, reinforce authority, and provide a formal communication network. Chain of command. COD. A system in an organization structure that documents how each member of a company reports to one another. Those jobs that ascend to the top reflect increased authority and represent the right or power to direct activities to the lesser rank. Span of control. Span of control addresses the issues of effective supervision expressed by the number of direct report to someone with line authority. Complex organizations have numerous highly specialized departments and has centralized authority. Less complex organizations have flat structure, authority is decentralized. Humanistic theory as a bridge between reductive and adaptive organizational theory. Development is a movement from the 1930s that addresses how people respond to working in large organizations brought on by the Industrial Revolution. The researchers concluded that the social attention and interactions created by the research itself, that is, the special human attention given to workers participating in the research, met a social need that enhanced productivity. Adaptive theories. The interplay among structures, people, technology, and environment led to perceiving organization as adaptive system. System theory. Concurrent thought about biologic and nursing science also led to breakthrough knowledge known as system theory. Open system. An open system organization draws on resources, known as inputs. Inputs. It can include materials, money and equipment as well as human capital with particular expertise. Adaptive theories. Throughput. The input are transformed when processes are coordinated with the mission of organization in mind, a process known as throughput. Output. the throughput used to create the goods and services desired, which are called output. Example: the readmission of patient with 120 days causes final penalties. Using information technology, bed management system are a tool to monitor patient throughput in real time. Contingency theories. It was developed to explain that organizational performance is enhanced when leaders attend to and interact directly with unique characteristics occurring in a changing environment. The environment defined here includes the people, object and ideas outside the organization. Chaos theory. It is linked to the field of complexity science, inspired by quantum mechanics. Complexity scientists observe in nature that nonlinear problems cannot be solved with the linear approaches tied to reductionism. Complexity science informs organizational leaders that all system will self-regulate over time. Example: Facebook is an example of a leaderless organization, created and managed by its communities of interest, serving its users through a broad set of principles that is self-monitored. Types of healthcare organization. Setting for the delivery of healthcare include primary care, acute care hospitals, home health care, long-term care organization. Primary care. Primary care is considered to be the location where patient goes for preventive and basic care services. Primary care is delivered neighborhood clinics, provider offices, ambulatory care, emergency departments, public health clinics. Acute care hospitals. Hospitals are frequently classified by length of stay and type of service. Most hospitals are acute short-term or episodic care facilities, and they may be classified as general or special care facilities such as pediatric, rehabilitative and psychiatry facilities. Home healthcare. Home healthcare is the intermittent, temporary delivery of healthcare in the home by skilled nurses or unskilled providers. Home health aides. Examples: wound care for pressure sores or a surgical wound, intravenous or nutrition therapy, injections. Long-term care. Long-term facilities constitute a range of service level known as assisted living services, including professional nursing care and rehabilitative services. Examples: independent living apartments, adults' homes, family types homes, continuing care retirement communities, nursing home. Terminologies used in management presented by Asia Batul. Definitions. Leader. The person who leads or commands a group, organization, or country. Manager. An individual employed by an organization who is responsible for efficiently accomplishing its goals. Management. The process of dealing with or controlling things or people. Decision making. A process whereby appropriate alternatives are weighed and one is ultimately selected. Definitions. Benchmarking. Benchmarking, a method of comparing performance using identified quality indications across institutions or disciplines. Evidence-based practice. Defined as the use of the best clinical evidence in making patient care decisions. Critical thinking. A process of examining underlying assumptions, interpreting and evaluating arguments, imagining and exploring alternatives, and developing reflective criticism for the purpose of reaching a reasoned, justifiable conclusion. Definitions. Mentor. A more experienced person who guides, supports, and nurtures a less experienced person. Leapfrog Group. A coalition of public and private employers organized to bring attention to consumers about quality indicators in healthcare and mobilize employers to reward healthcare organizations that demonstrate quality outcome measures. Quality management. A preventive approach designed to address problems efficiently and quickly. Reference. Sullivan, Eleanor J. 2017. Effective Leadership and Management in Nursing, 9th edition, PG number 1324. Costello, D. 2008. Report from Field, A Checkup for Retail Medicine Health Affairs, PG number 27. Galbraith, J.R. 2009. Designing matrix organization that actually works. PG number 26.